Hi, my name is Dr. Lauren Adler. I'm a pediatrician with Westchester Health Pediatrics in Mount Kisco, and I'm here to talk today about fever in your child and how fever is really your friend. There's no reason to be afraid when your child has a fever. I'm going to start off by talking about how to take your child's temperature. For a small infant, the best way to take your child's temperature, and even for an older child, is rectally. You get the most accurate temperature that way. And don't be afraid to do it. It's really benign. Your kids don't mind. It takes just a minute or two. You put a little bit of Vaseline or KY jelly on the tip of the thermometer, insert it into the rectum, and in a minute or so you have a very accurate temperature. A rectal temperature over 100.4 is actually considered a fever. Anything less than 100.4 rectally is a normal temperature. Your temperature naturally varies throughout the day, anywhere from a little bit less than 98.6 all the way up to 100.4. So don't worry if your child has a 99 or 100. For older children, you can use a digital thermometer under the tongue or in the ear, and you can get a pretty accurate temperature that way. If you have a really fussy toddler who won't stay still, I often take my own child's temperature under the armpit. You just insert the thermometer under the armpit, hold the armpit down. It takes a little bit longer and you need to add a degree, but that's another way you could take your child's temperature. In a small infant, less than 8 weeks of old, any temperature over 100.4 is a serious problem and you need to take your child to your pediatrician. Other than that, in an older child, an older infant, fever is your body's way of fighting an infection. There's no reason to be afraid of it. If your child has a high fever and they're uncomfortable, you do want to treat them, mostly to make them feel more comfortable. You can use acetaminophen, which is Tylenol, or ibuprofen, which is Advil or Motrin. Any of those work. Tylenol you can give every 4 hours, and the ibuprofen you can give every 6 to 8 hours. The best way, I think, to measure the dose is with a little syringe. You can also use a cup. It's a little bit less accurate. The syringe is better, and then you could just squirt it right into your baby's mouth. You never, ever, ever want to use a kitchen spoon to measure Tylenol. Even though you might hear that the dose is 1 teaspoon, a kitchen spoon is not an accurate measurement. You can always look on the side of the box for the dosing. However, a general rule of thumb that I like to use that's easy to figure out is a teaspoon of either acetaminophen or ibuprofen for every 20 pounds. So if your child weighs 20 pounds, you can give them a teaspoon, which is 5 mLs. If your child weighs 30 pounds, you can give them a teaspoon and a half. And you could do the math from there. Just remember, you want to treat your child's fever to make them feel comfortable, but that fever is not dangerous, and you don't need to panic when your child has a fever. It's just their body's way of fighting the infection.